I just wanted to thank everybody for joining us this afternoon to talk about the RFP that we put out for the workforce training program for LTPAC and home health care industry workers. My name is Lawrence Stuntz. I'm the director of MIHI, and on the phone with, I'll just go through quickly the agenda for today's call. So we'll do a brief introduction. Jennifer Sauberman will give some overview of the legal considerations. Then I'll give an overview of MIHI and our purpose and the purpose behind this overview. And then Katie Green will give some more details on the RFP background and the application process, and then we'll answer questions. Just to make it easy for us to record and respond to the questions, because we need to respond to them in a written way, please type your question into the little box on the WebEx, and then we'll address them at the end if at all possible. We'll also have the opportunity to take verbal questions, but it'll make it easier if you are able to type in the questions ahead of time. So just so you know who's on from our end, I'm Lawrence Stuntz. I'm the director for MIHI. Katie Green is the project manager for this project and managing this solicitation and the procurement. And then Jennifer Sauberman is our assistant general counsel. And we'll handle questions at the end. So, legal considerations.
So I will go through this quickly because it's boring legal stuff. The RFP has been posted on the MassTech, MIHI, and Combi websites. And if there is anything that is said during this presentation that's inconsistent with the RFP, please know that the RFP written documents will govern any of the inconsistencies. We reserve all rights to amend, modify, or otherwise clarify the RFP and any written answers to the questions that are presented today. Please make sure that, and it is your responsibility to check the MassTech or Combi's website for any changes to the RFP. And make sure just to review it carefully, and if your applications are non-responsive, they will be rejected.
Thanks, Jennifer. So just quickly, so that folks have background in case you're not familiar with MIHI or with MassTech. MassTech was established in 1982, I believe, a long time ago, as part of Massachusetts general laws, or it's encoded in Massachusetts general laws, Chapter 40J. It's an independent authority of the Commonwealth of Massachusetts. And then MIHI was created in 2008 as a non-divisible component of MassTech. So we're a business division of MassTech. MassTech ends up as the contracting entity for any of the work that MIHI does, and so we work very closely with MassTech, but our specific focus is on e-health and the advancement of technology in healthcare area. And I seem to have challenged my capacity to move through the slides. All right. So MIHI overview, as you can see, MIHI is one of 3 divisions of MassTech. The other 2 divisions are the Innovation Institute, which has programs such as their Tech Hub collaborative, the Big Data Consortium, and the Big Data Initiative that are being pushed forward to help support that industry in Massachusetts, the Advanced Manufacturing Collaborative, and one of the things that the Innovation Institute has been doing for the last 10 years or more is writing and publishing annually the Innovation Index, which is a publication describing Massachusetts, how we're doing in mostly the tech-based or the innovation economy. So that comes out every year. The Mass Broadband Institute is responsible for building a fiber network all across Western Mass. They have completed the construction of what they call the middle mile, which has connected over 1,100 actually, community anchor institutions in more than 120 towns, and they are in the process of working on their next mile solution to extend the reach that network out to the unserved and underserved communities and towns across Western Mass. And we also built and run as part of that a website for Massachusetts veterans to help find their benefits called Mass Vets Advisor. And then MIHI, page down. So we're a division of the Mass Tech Collaborative, as I mentioned, and we're responsible for coordinating healthcare innovation, technology, and competitiveness, accelerating the adoption of health information technology, promoting health IT, and advancing its dissemination across the state. So, we've been given a pretty broad charge to help with getting technology adopted by healthcare providers, helping to promote the innovation in technology and in healthcare using technology. So our vision, mission, and goals are up here. The things that I really take away from this are embedded in the mission. Our goal is to engage the healthcare community. We want stakeholders from across that community. We take as a core principle that we ask stakeholders all across the Commonwealth for input on any of our programs. We want to catalyze the development, adoption, and effective use of health IT. So, we don't have funding to pay for all of this, but we want to create demonstration projects. We want to get the ball rolling on a lot of different areas, and I think that this project, this pilot program that we're sponsoring, that's being funded through the Healthcare Workforce Transformation Trust Fund, administered by the Commonwealth Corporation, is one good example of this, where we're going to get this program off the ground and then ask and hope that the different organizations across the state who have access to the new curriculum will then use it to further the training of our healthcare workforce. Our core goals over the next few years: we are supporting every provider in the state in adopting interoperable EHRs. We're on our way, but we still have a lot of work to do, and I'll talk about our programs that are supporting that very briefly. We want to support health reform using technology to support the overall goals of health reform. In this, we work very closely with other state agencies responsible for implementing different aspects of Massachusetts health reform, primarily the Health Policy Commission, but also the Massachusetts Department or Executive Office of Health and Human Services, Department of Health, the Center for Health Information Analysis, and all the other organizations that have a piece of supporting Massachusetts health reform. Our goal is to engage consumers in the to participate more fully in electronic health and to use technology to manage their own health, and finally to grow and promote innovation in the e-health cluster. We think that this is a potentially very large growth area for Massachusetts economy, and expect to see this expand, and are identifying ways that we can help the health IT companies expand here in Massachusetts. So our core initiatives, and we have 4 core initiatives right now that over the balance of this year and through into next year. The eHealth Equality Program focuses on helping behavioral health and long-term post-acute care providers adopt EHRs, primarily through the use of incentive grants and technical assistance in supporting those organizations in helping to adopt EHRs. The Connected Communities Program is helping to develop, or is developing, working with communities across the state, the eHealth plan that looks out several years for and identifying ways to help organizations work together, exchange information, and use technology to identify or use technology to address some of their most pressing health needs. Primary focus from a provider perspective in those areas will again be in the behavioral health and long-term post-acute areas, identifying health problems in those areas specifically. eHealth services and support helps providers who need more focused support in complying with different regulations like meaningful use or physician quality reporting, any of those services, and so we're helping providers across the state with that. This is an extension of the Regional Extension Center work and the Medicaid meaningful use application payment work that we've been doing. And then the eHealth cluster development has both a responsibility in doing work around supporting organizations or supporting software companies in expanding their footprint, but the healthcare workforce piece of our responsibility also falls in the eHealth cluster development. So workforce development is a piece of eHealth cluster development for us. So I'll talk briefly about the RFP, and since I'm not hearing anything on the phone, I just do want to check in quickly and make sure that we didn't somehow lose everybody. Is everybody still out there?
Still out here.
All right, great. I get nervous on conference calls like this. So from an RFP perspective, and the point of this this procurement and this solicitation, so as part of Chapter 224 in the Acts of 2012, we were required to establish, and you can read this, I won't read it to you, but a pilot partnership to support healthcare information technology, curriculum development, and workforce development. So the Chapter 224 established the Healthcare Workforce Transformation Trust Fund, and that's administered by the Secretary of the Executive Office of Labor and Workforce Development, and then through a process of working with different stakeholders in this area and thinking about where we could discern the greatest need for a pilot program such as this, which is focused at middle skilled workers and really trying to have as big of an impact as possible, we decided on the scope of this project, which is, we did a little survey of long-term post-acute and home health sector work for trade associations. Some of you on the phone participated in that, so thank you very much. And we identified that health IT training for entry-level workers, whether those be certified nursing assistants or other entry-level workers, would provide the greatest bang for our buck in terms of supporting a broad need and being able to produce something that could be relatively easily rolled out to the many workers who do need this. And then, so our approach has been to request, as part of this RFP, that four core components be delivered as part of the training. One is the Health IT curriculum module. And this is the initial module that will be delivered to the healthcare workers. A module to train trainers on that module. Delivery of the Train the Trainer module, so training a set of trainers as part of this. And then a proposal to directly deliver the curriculum to employees and these healthcare workers. Part of the challenge that we were trying to address with the structure of this program is that these workers are distributed all across the state, and we know that there's a pretty large contingent of new CNAs that come through every year and so on. And so what we didn't want to do is try to deliver this curriculum just in one part of the state. We wanted to create a structure that would allow us to, over time, use one core curriculum and spread it out all across the state. So what we want to understand as part of the project itself, this last piece is a proposal, or we're requesting as part of this last deliverable, a proposal from you on how you would recommend delivering that and what it would cost to actually deliver this curriculum on an ongoing basis. So that's the approach and background. Now I'm going to turn it over to Katie Green, the project manager, and she's going to just give you a little bit more depth on the specific modules and the RFP process and overview.
Great, thank you. So the Health IT curriculum module component, we've asked that since this is a smaller pilot program, that it focus on either one or two sort of basic health IT training topics. And while we've suggested a couple potential training topics, we want to make sure that the one you choose is based on your research into the industry needs. So what are the agencies in your area in particular looking for in terms of training? So we're hoping that your proposal includes some justification for why you selected that topic. And some of the topics we've suggested are privacy and security, networking health information exchange, or health management information systems. And again, since it's a smaller pilot program, our idea is that it would be sort of kind of a basic and introductory course. And so we think that this should take no more than 8 hours of training, but would like some justification for how long you think the various topics should take. And then the second component is the train the trainer module and delivery. So the training, when you deliver it, should include a minimum of 5 Massachusetts-based long-term post-acute care and home health care agencies, staff from interested and affiliated trade associations, as well as staff from MIHI. And we can also have said that you can partner with a vocational technical school or other organization, such as a union, in the delivery of the curriculum, of the Train the Trainer curriculum. And we also have asked that the format of both the healthcare curriculum module and the Train the Trainer module be presented to us in a format that could be used by people outside of your organization at a future date. And then the deliverables related to each of the 4 components are up here, so I won't read them all, but the Health IT curriculum development is essentially just the module we talked about. The Train the Trainer module, which would include the actual module and a plan for how you'd recruit and incentivize staff at long-term post-acute care and home health care agencies to participate in the pilot program. Delivering the actual module, which is conducting it and writing up a report on the experience and the lessons learned. And then we've also asked that you include recommendations for the best methods to disseminate the module and how to collect data on analyzing the effectiveness of the pilot program. And as part of this, you must collaborate with the Massachusetts Community College Executive Office on this aspect of it. And then the final part is the part that Lawrence talked about, the proposal to deliver the curriculum module directly to staff. How you would do that, the expected cost for doing that, and how many people you think you could reach within the grant period. Okay, so that's the basic information about the RFP. So this is the timeline. We posted it on October 15th. The webinar is obviously today. And just, we have to stick very closely to all of these deadlines. We just want to make sure you see them all and are aware of all of them. So any final written questions are due on November 7th at 5 p.m. And this information is in here later, but they can be emailed to proposals@masstech.org. And we will post all of the answers to any questions filed by the 14th at 5 p.m. and those will be available on the MassTech, MIHI, and COMBI's websites. And so it's up to you to check for those. And then very importantly, applications are due by 3 p.m. on November 25th. And if you have to amend something later, that's fine, but just make sure you have something in to proposals@masstech.org by 3 p.m. Or we cannot review your application. And then we expect to make a decision sometime in mid-December, and then contract to start in the new year. And then the applications have to include a proposal narrative, a high-level work plan. There's a template included in the RFP for that, a budget by task. There's a template for that as well, the signed signature and acceptance form, the signed organizational approval letter, and then just a sketch for the proposed project director and key staff involved. And then these are what we will evaluate the proposals on in no particular order. Your demonstrated experience in developing and disseminating curriculum modules, your experience and knowledge of health IT, your familiarity with Massachusetts long-term post-acute care and home health care sectors, the proposed number of people who you think will receive the training during the grant period through both the pilot train the trainer program and any direct delivery, the quality of the project plan, and then the overall budget. So questions can be submitted to proposals@masstech.org, and again by 5 p.m. on the 7th, and we will respond to them by the 14th. Thank you. So are there any questions?
So at this time, we have one question that's been written, which is, how can the Executive Office of the Mass Community Colleges help the recipient of this grant? So, and we'll provide the written response to this as well, but, you know, as part of one of the deliverables, the recipient is directed to work with the executive office on a plan to disseminate the results across or disseminate the curriculum and basically get it rolled out as broadly as possible across the Commonwealth. Beyond that, I think it would be up to the respondents to work with the executive office in any way they choose. There's no restriction against the executive office partnering with one or more of the respondents on the proposal. The next question is, what are the total funds available for this? I think we put this in the RFP as well, but if not, the total budget for this is $200,000 that we have from the Healthcare Workforce Transformation Trust Fund administered by the Commonwealth Corporation. And the total number of awardees, question is that we are intending to award this to one primary respondent, one community college, but that community college can partner with whomever they want to as part of this. You know, they can partner with the Voc School to handle delivery. One of the things that we found in much of our research was that there are a lot of vocational schools that have CNA programs, and there may be a network of folks that folks want to bring into this to deliver this training, both to train the trainer, to get Voc schools to incorporate this, as well as potentially as a way to deliver this directly to CNAs. Anticipate lead agency will work across the state. So the question here is, and correct me if I'm wrong, but the question is, do you anticipate that the lead agency or the awardee will work across the state? I think what we're trying to understand from each of you, or from the respondents, is what is the best way to roll this out. We know that many of you are geographically focused, and so what we wanted to understand is that, in this pilot, which is really a develop the curriculum, develop the train the trainer, ideally, that the train the trainer would be delivered to multiple folks across the state, but we'd like to understand your capacity for doing that as part of your response. Second question, or most recent question, how much focus should be on new direct care workers versus incumbent workers? So, this is a question that we had for the agencies, the long-term post-acute care and the home health care agencies. I think there is probably a larger need for new workers necessarily than incumbent workers, but the curriculum should be should be available to use for either, whether that's whether it's a training program that's not associated with an agency because these are folks who are still looking for jobs, or the curriculum could be used for incumbent workers who need an intro to health IT training. Our goal is that, as this might be applicable to agencies who are starting to get onto electronic health records, and they might want to use this curriculum to train their staff as part of a rollout of an EHR, as well as just providing basic level understanding for individual or for potential new entrants to the industry. That's all the questions that have come in through writing. Any other questions that we can answer? All right, can we still hear everybody, since I'm nervous again? Or can everybody still hear us? Check and make sure that they're all unmuted. All right, can anybody hear us?
Yes, everybody can hear you.
All right, I heard somebody say that they could.
I wonder if they'll have this
now. How should the school, the most recent question is, how should the schools demonstrate that they have industry knowledge? I think as part of the response, the schools or the respondent should document what level of information they have that's informing their recommendations about the curriculum that needs to be developed. So I think it would be appropriate for the school to talk about who they've interviewed, who they've gathered requirements from, what their prior experience may have been in terms of delivering this type of training, and all of those will go into assessment of knowledge about the industry.
You go down to 10 points. Sure.
Any other questions?
So we've got some stuff. So loosey-goosey unless we just write to the...
All right, well, I guess if we don't have any further questions, we will provide written answers to all of these questions. And if you do have other questions, please send them in to proposals@masstech.org by November 7th at 5 p.m. and we will post them by the following Friday. So basically 2 weeks from now, or almost 2 weeks from now, questions are due. The answers will be posted by the following Friday, and then the responses are due by the Tuesday before Thanksgiving, November 25th at 3 p.m. Eastern. We wanted to make sure not to ruin anybody's Thanksgiving responding to this. So unless there are any further questions, I'll just wait another 30 seconds for somebody to shout out or type in. Question is, will you make the website slides available on the site? Yes. And second question is, will you post answers to current questions right away? Yes. We'll just type them up probably this afternoon and post them as well.
What site is it on? I imagine on their Mass Tech. I'm going to go right on.
Yeah, I don't know if that was intended as a question, but if you go to mihai.masstech.org and you click on the procurements link, you will see the link to the page. I asked the team to also put it up under the funding link because that's where I went to find it this morning and didn't find it there. So it should be, it might be there by now. But if you go to mihai.masstech.org and the orange procurements link, you will find this RFP and the link to this page, or the page where we've got the RFP itself, and we will post this presentation as well as the questions and answers.
What did they replace Compass with? Oh, project or something like that. Yeah. So they don't put those things there anymore? It might be.
We'll also post questions and answers to the Combis website. Do you know how to do that? Ross does it. So they will be up on our website very quickly. The person who knows most about Combis is out this week, so we may have to find a backup on that. Any other questions?
Where's the narrative? Right.
Okay. Well, thank you all very much, and thank you to Commonwealth Corporation and the Secretary of Labor, and we will get back to you. There's one more question that's come in. It says, is there a specific format for the narrative? No, I think we did. Yeah, we didn't. There is a specific format for the budget in the solicitation that should be adhered to, and to the work plan that should be adhered to, but the narrative can be in any format that you're comfortable with, as long as it describes the answers to all the different, describes your approach to and the background and how you're going to support answering the deliverables.
200,000. I'd be the only one in this space.
Number of pages for the narrative, that was in the RFP earlier, maximum of 8 pages.
Okay, well, so loosey-goosey.
All right. Well, thank you all very much, and just send us any other